Although there are very few true orthodontic emergencies, during the course of treatment you may discover that parts of your braces may become loose or broken. You may also discover that wires may shift and begin irritating your lips or cheeks. In this video, we will address some possible orthodontic situations and how they may be remedied at home. If you have a problem that you cannot resolve on your own, call your orthodontist's office. Your orthodontic team will be able to give you advice on how to solve the problem yourself or schedule an appointment so that your problem can be fixed. Your teeth may become sore the first time separators or wires are placed or following an orthodontic activation appointment. Usually, the teeth are most sore during the first 24 to 72 hours. After 72 hours, the teeth usually start feeling better. Maintain a soft food diet as needed. If necessary, take the pain reliever you would normally use for a headache. During the first week of treatment, you may notice sores or ulcerations inside your mouth. This can happen because your lips and cheeks are not used to rubbing against your braces. Over time, your skin on the inside of your mouth will get tougher and you will no longer have sores. To provide some relief for your lips and cheeks rubbing against your rough braces, you can place a small pea-sized amount of wax or cotton on the area of the braces that is causing the sore or ulceration. To place wax, break off a piece and roll it into a pea-sized ball. To get the wax to stick, dry the area with a cotton swab and then press the ball of wax over the area of irritation. Mold the wax with your fingers until it is smooth. Remove the wax when eating or brushing and reapply as needed. The sore should improve within a couple of days and completely heal within a week. If the sore or ulceration does not improve or gets worse, call your orthodontist to have it examined. During the course of treatment, you may discover that a band or bracket is loose. This is usually caused by playing with your braces or eating hard or sticky foods. This is generally not an emergency unless it is associated with pain or discomfort. You will need to call your orthodontist's office to make an appointment to have the band or bracket put back on. Sometimes during eating or brushing, a metal tie wire can accidentally be redirected and cause irritation to your lips or cheeks. You can try to push the protruding wire back into place by using the eraser at the end of a pencil. If that is not possible, you can place wax on the area causing the irritation until you can be seen by your orthodontist to have it fixed. If an elastic tie falls off, call your orthodontist's office. Sometimes you can wait until your next appointment to have it replaced. Other times, your orthodontist will want to see you for a quick visit to put the elastic tie back on. During the beginning stages of treatment, flexible wires will be used to align your teeth. Sometimes, when you're eating, these wires can bend and pop out of the band or molar tube. This happens more often in areas with a long span of uncovered wire. When this happens, you can try carefully reinserting the wire into the tube using a pair of tweezers. If this is not possible, you can use a piece of wax to hold the arch wire in place. As a last resort, you can try to cut the wire next to the closest bracket with a pair of nail clippers or a small wire cutter that has been cleaned with alcohol. Be sure to consult your orthodontist before you attempt this. Sometimes as your teeth shift, the ends of the wire will start poking out the back and begin irritating the cheeks. If this happens, you can place some wax over the protruding end of the wire and call your orthodontist's office so they can clip the wire for you. Remember, There are very few true orthodontic emergencies. Most problems can be taken care of at home. However, if you have a problem that you cannot resolve on your own, call your orthodontist's office. Your orthodontic team will be able to give you advice on how to solve the problem yourself or schedule you an appointment.